Hi, today we're going to talk about Coolsculpting versus Kybella. So now we have two effective, non-surgical ways to reduce the fat under the chin. So Kybella is the first of those ways. It got FDA approved earlier this year. And here's some of the pictures from the FDA approval study. What you can see is the subcutaneous fat, or the fat immediately under the skin, is decreased with Kybella. It's a really remarkable treatment. It's a treatment that takes 2 to 5 sessions. Each session requires 20 or 30 needle sticks. You get a few days of swelling and redness underneath there, and then reduction in fat. We have these sessions spaced roughly 4 to 6 weeks apart. Good subcutaneous fat reduction. The deeper fat under the platysmal muscle and the jowl fat, we really can't inject with Kybella, and so it's its main limitation. The second main limitation is it's a series of needle sticks. It's a bunch of needle sticks, 30 or 40 sometimes, anywhere from 2 to 5 sessions. So that brings on its third limitation, and that's cost. Each session costs anywhere between $1,200 and $1,500. So then when you really say, okay, I'm going to get 30 or 40 needle sticks and swell for 3 or 4 days, and the total cost of my 2 to 5 sessions can approach $5,000 or $6,000 to get this result while I'm treating only the fat underneath the skin, it's exciting, but it's not that exciting. So what I'm currently even more excited about is the Coolsculpting Cool Mini applicator. And this is something special. This is a treatment you do twice, not 2 to 5 times. You do it twice. The first treatment you do, the area clamps on under the chin. There are no needle sticks, minimal swelling the next day, nothing like the Kybella swelling. The treatment's an hour. The next day it's minimally swollen, go about your life. 1 month later we repeat it. Second treatment's an hour, minimally swollen, you go about your life. And these are some results that we see from the clinical study where the Coolsculpting was approved, the Cool Mini applicator was approved. You can see here these are much more dramatic. These results, they really show a dramatic improvement in subcutaneous fat. They show some improvement in skin tone, and they even show some improvement in the deeper layer of fat behind the platysmal muscle, which is something we can't do with Kybella. So I think this is, all in all, the much better treatment. Interestingly, the Cool Mini, the total treatment price for both treatments is going to be $2,000. So maybe a third of what you might pay for an aggressive several rounds of Kybella, but with, in my opinion, a much better result. So back to the topic of the video, is Kybella obsolete? Well, for the most part, I think it is. I think for practices that have a Coolsculpting machine, which is no small investment, I think their patients are an advantage because they can have the Cool Mini, get 2 treatments, and really see a dramatic result. For practices that don't have the Cool Mini, or don't have the Coolsculpting machine, I think Kybella is a viable option. And then the other place, even for practices that have the Cool Mini, where they still may find themselves using Kybella, is in narrow jawlines. This applicator is a one-size-fits-all jawline. If your jawline is too narrow to get this applicator to go on and hold suction, and you just have a little pouch of fat with a narrow mandible, this applicator is not going to work for you. And Coolsculpting isn't going to work for you, so you're going to be stuck again with either Kybella or traditional liposuction. So the bottom line, I think Kybella is facing a bunch of stiff competition from the Cool Mini, and I'm super excited for our patients. Thank you.